What if the pain you're trying to escape is actually trying to protect you? We're taught to numb it, hide it, push through it. But some pain is a message, not a punishment. In this video, I'm going to show you 7 unexpected pains that might just be the thing standing between you and self-destruction. Stick around until the end, because the last one is the most dangerous to ignore. Let's kick things off with a pain that's often misunderstood: chest pain. It's a sensation that can strike fear into anyone, and for good reason. But it's important to understand that not all chest pain is the same. Now, I know what you're thinking: chest pain must be a heart attack. This is a common assumption, and while it's true that chest pain can be a symptom of a heart attack, it's not the only cause. While chest pain can definitely be a sign of a heart attack, and if you experience sudden, severe chest pain, you need to call 911 immediately. Not all chest pain is created equal. There are various other conditions that can cause chest pain, some of which are less serious but still require attention. Sometimes it can be caused by something as simple as heartburn or muscle strain. Heartburn, for instance, is a common issue that many people experience after eating a large meal or consuming spicy foods. It can cause a burning sensation in the chest that might be mistaken for something more serious. But how do you tell the difference? This is where it gets a bit tricky, but understanding the nuances can help you make better decisions about your health. Well, heart attack pain is often described as a crushing pressure or tightness in the chest. This type of pain is usually persistent and doesn't go away with rest. It's a signal that something is seriously wrong. It can radiate to your arms, jaw, back, or even your stomach. This spreading pain is a hallmark of a heart attack and should never be ignored. You might also experience shortness of breath, sweating, nausea, or lightheadedness. These symptoms often accompany the chest pain and can make the situation even more alarming. These are all signs that your heart isn't getting enough oxygen, and you need to seek medical attention as soon as possible. Ignoring these symptoms can lead to severe consequences, so it's always better to be safe and get checked out by a professional. On the other hand, chest pain can also be caused by anxiety or panic attacks. These conditions can mimic the symptoms of a heart attack, making it difficult to distinguish between the two. However, anxiety-related chest pain is often accompanied by a feeling of impending doom or intense fear. Other causes of chest pain include costochondritis, which is inflammation of the cartilage in the rib cage, and pleurisy, an inflammation of the lining around the lungs. Both of these conditions can cause sharp stabbing pain that worsens with movement or deep breathing. Even shingles, a viral infection, can cause chest pain if the rash appears on your chest. Esophageal spasms, which are sudden painful contractions of the esophagus, can also mimic heart attack pain. The key takeaway here is that chest pain should never be ignored. Whether it's a heart attack or something less severe, it's crucial to get a proper diagnosis. Always consult with a healthcare professional to determine the cause and appropriate treatment. Next up, we've got a pain that's nothing short of terrifying: the thunderclap headache. Imagine going about your day, everything seems normal, and then suddenly, out of nowhere, you're hit with an excruciating pain that feels like your head is about to explode. This one's named appropriately because it hits you like a bolt from the blue, often reaching peak intensity within seconds. It's not just a regular headache. It's a sudden, severe pain that can leave you feeling completely debilitated. A sudden, severe headache like this is not something to take lightly. It's your body's way of signaling that something could be seriously wrong. Unlike other headaches that might build up gradually, a thunderclap headache strikes with full force almost immediately. It could be a sign of a stroke, an aneurysm, or another serious condition affecting your brain. These are medical emergencies that require immediate attention. The sudden onset and intensity of the pain are what make thunderclap headaches particularly alarming. Now, I know it's easy to brush off a headache. We've all been there. Maybe you think it's just stress or dehydration, and you try to push through it. But a thunderclap headache is different. It's not something you can or should ignore. But a thunderclap headache is different. The intensity and suddenness of the pain are unlike anything you've experienced before. It's a clear signal that you need to seek medical help immediately. It's often described as the worst headache of your life, and it can be accompanied by other symptoms like a stiff neck, fever, confusion, vision changes, or even seizures. These additional symptoms can help differentiate a thunderclap headache from other types of headaches. If you ever experience this type of headache, don't wait. Get to the ER immediately. Time is of the essence when dealing with potential brain conditions. The faster you get help, the better your chances of avoiding serious complications. Remember, it's always better to be safe and get checked out by a professional. Now, let's move on to a pain we've all experienced at some point: abdominal pain. Our stomachs are complex organs, and pain in this area can be caused by a whole host of things, from indigestion to gas to that extra slice of pizza you shouldn't have eaten. But persistent or severe abdominal pain is a different story. This could be a sign of something more serious, like appendicitis, pancreatitis, gallstones, or even a bowel obstruction. So how do you know when it's time to worry? Well, if your abdominal pain is severe, doesn't improve after a few hours, or is accompanied by other symptoms like fever, vomiting, bloody stools, or inability to pass gas, it's time to head to the doctor. Chapter 4. Let's talk about back pain, shall we? It's a topic that affects millions of people around the world, and it's something that can range from a minor inconvenience to a debilitating condition. It's one of the most common reasons people see a doctor, and it can be caused by a variety of factors. Most of us will experience back pain at some point in our lives, whether it's from lifting something heavy, sitting for too long, or just sleeping in an awkward position. But while most back pain is caused by muscle strain or poor posture, there are times when it can be a sign of something far more serious. For instance, if you experience back pain that doesn't go away with rest or over-the-counter pain relievers, it might be time to see a doctor. We're talking about conditions like kidney stones, spinal infections, or even an aortic aneurysm. An aortic aneurysm is a serious condition where there's a weakening in the wall of the aorta, the main artery that carries blood from your heart to the rest of your body. If this condition is not treated, it can lead to life-threatening complications. The aorta is crucial for your body's blood circulation, and any issues with it can have serious repercussions. Severe back pain that comes on suddenly, especially if it's accompanied by other symptoms, should never be ignored. If you have back pain along with fever, chills, or weakness, it could be a sign of an infection or another serious condition. Numbness in your legs or any other unusual symptoms should prompt you to seek medical attention immediately. On the other hand, there are many ways to prevent and manage back pain. Regular exercise, maintaining good posture, and being mindful of how you lift heavy objects can all help. Using ergonomic furniture and taking breaks to move around if you sit for long periods can also make a big difference. Practices like yoga and meditation can help reduce stress, which is another common cause of back pain. By taking care of your body and being aware of the signs that something might be wrong, you can keep your back healthy and pain-free. Remember, your spine is a crucial part of your body, and paying attention to its signals can help you avoid serious health issues. So the next time you feel that twinge in your back, don't just brush it off. Listen to your body and take action if needed. Your back will thank you for it. Now let's move on to leg pain. Our legs are constantly on the go, so it's no surprise that they can ache or throb from time to time. But pain in your leg, especially if it's accompanied by swelling, redness, or warmth, could be a sign of a blood clot, also known as deep vein thrombosis or DVT. This is a serious condition where a blood clot forms in a deep vein, usually in the legs. If that clot breaks free and travels to your lungs, it can cause a pulmonary embolism, which can be life-threatening. So, if you experience unexplained leg pain, especially if it's in one leg and not the other, don't hesitate to get it checked out. Jaw pain is up next, and this one might surprise you. While most people associate jaw pain with dental problems, it can actually be a symptom of a heart attack, especially in women. Now, this doesn't mean every time your jaw aches you're having a heart attack. But if you experience jaw pain that comes on suddenly, feels intense or crushing, and is accompanied by other symptoms like chest pain, shortness of breath, or nausea, don't wait to see if it passes. Call 911 immediately. Finally, let's talk about pelvic pain. This one's specifically for the ladies out there. Pelvic pain is common, especially during menstruation. But severe pelvic pain that comes on suddenly, or is accompanied by other symptoms like fever, nausea, or abnormal vaginal bleeding could be a sign of something more serious, like ovarian torsion, which is a twisting of the ovary, or an ectopic pregnancy, where the fertilized egg implants outside the uterus. These conditions require immediate medical attention, so don't hesitate to seek help if you're experiencing severe pelvic pain. Remember, your body is always communicating with you. Don't ignore these warning signs. Pain is your body's way of telling you something's wrong. If you experience any of these pains, especially if they're severe or accompanied by other symptoms, consult a healthcare professional immediately. Early detection and treatment can make all the difference. Stay healthy and stay informed. Until next time, this is Dr. Mike signing off.